Hi, this is Pat McDonald, your host for Vote for Vermont, where our tagline is listening beyond the soundbites. Tonight, we have Sandy Rousse with us, who's the CEO of Central Vermont Home Health and Hospice. Welcome.
Thanks, Pat, for having me.
Oh, you're welcome.
It's good seeing you.
Yes. It's a great organization, and just for transparency, I'm on 2 of your committees, I think. All about raising money, which is what we like here. Anyway, could you talk a little bit about yourselves for those who may not know?
Sure. So I've worked at Central Vermont Home Health for almost 20 years now.
Wow, good.
And originally born and raised in Rhode Island. And my mom actually originally was from Barre, so have some deep roots in the community. And in all honesty, my uncle, Paul Beck, who owned Beck & Beck Granite Shed from Barre, recommended me for the Central Vermont Home Health and Hospice Board when I first moved here.
Right.
I am a CPA by trade, so at the time I was working for a public accounting firm, and I was really interested. I had a couple friends that worked for the organization. I came on as a board member as well as a finance committee member. I then became chair of the finance committee and treasurer of the board. And then around, I want to say 1998 or so is when I came on the board. About 4 years later, 2002, I was asked to apply for the chief financial officer position.
Great.
So came on into the organization. Eileen Blake was the CEO at the time.
Right.
And had the opportunity to work with Eileen as well as the next CEO, Judy Peterson, and really expand my knowledge of home health and hospice.
Right.
And I'm a real, hands-on, visual learner, want to know about the organization. So I wasn't just your normal or what's considered normal bean counter, so to speak. And I had the opportunity to work in all aspects of the organization. I was able to go out in the field with the clinicians. I was there lots of times on the weekends, getting to know the clinicians who were working the weekends. And I really got my interest in quality. So Connie Coleman at the time, our director of quality, taught me a lot about quality improvement. And then I worked with the hospice team and certainly just became embedded throughout the organization. And later on, I was promoted to Chief Operating Officer, of which I oversaw all of finance, IT, and our long-term care programs, and met with the Director of Clinical Services on a regular basis. And then in 2012, I applied for the CEO position.
There you go.
Here I am.
That's great. Well, I know you're well respected in Washington County for sure,
thank you.
Especially among all the nonprofits, because you guys work so closely together.
We do.
All of you.
We really do. And a lot of my work as the CEO is really about building relationships and, being collaborative with the state and our local hospital and the UVM Health Network, as well as multiple social service agencies, mental health agencies in our area. And I really think Central Vermont is an amazing place.
It is, isn't it? When
to do
there's trouble,
business and
everybody steps up.
to work for a not-for-profit organization and also to live.
Yeah, that's great. I have to say, because you mentioned home visits, and I when I was on the board, I actually had to step down because of this show, just for the record, which was sad. But I went on a home visit with one of the home nurses, and since that day, I've said to people, don't ever think you know when you see a McMansion what goes on behind the doors. Because you really don't know. You assume when you see somebody's lovely home, but you don't know, and maybe you should zip it up if you don't know. And especially, we were talking, I think Mary Moulton brought this up, 1 in 3 Vermonters suffer from food insufficiency.
Yes.
Because that's the first thing that you can cut back on.
Absolutely.
And I learned that from being on the board, and I have been very vocal about that. When people make a comment, I'm like, you really, unless unless you've walked a mile in somebody's shoe, just zip it up.
Yeah, and our staff are really fortunate to work in such an amazing community because they can just reach out and connect individuals with all these amazing organizations we have in Central Vermont.
So now, because you're talking about reaching out, and my husband's used your services 4 times now, I think, and my sister and my mother and everybody else. I have not, no offense, but I'm hoping not. But how have you managed in COVID? Because you have to, most of the time you have to visit these people.
Right, right. So fortunately, our organization has always had a motto of being able to be nimble. That's always something that has been in the forefront of any strategic planning that we've done, any visioning, any growth, et cetera. And as a result, we were really able to turn that key pretty quickly.
Yeah.
And we have amazing staff. Our clinical staff are already remote anyhow. They have laptops that they use on a regular basis. We were already starting to use Zoom with them. We had been having morning huddle calls with all our clinical teams and having that capability for individuals to plug in when they're on the road to team meetings and other things that we conduct. So that's the majority
That's
of our
great.
staff. So they already had those capabilities to be able to do that. And certainly they do that work in the home with their laptops, et cetera. As for administrative staff, we have an amazing team of IT professionals, only 2 of them, but they were able to actually push our administrative
Great.
staff off-site, get them connected, get them set up with whatever they needed for equipment at home in a very short period of time as soon as the governor issued his first executive order.
That's great.
So we were very fortunate and able to be very nimble. We accommodated Zoom very quickly.
Yeah.
And we were all meeting from our offices. There was a crew of us at the agency on a regular basis,
Yeah.
and we were communicating electronically.
Well, I know when Bruce had his services, they came in with,
Yes,
what do you call those?
the face shields.
Face shields and masks. And
Right.
we were asked to wear masks, and
Yep.
we did out of respect for them.
Yeah.
So it worked out very
Right.
nicely.
And we did have to, we pulled an internal COVID team together, so several individuals, and we were meeting every other day to really talk about what was going on, what we needed, et cetera. We did have some struggles with getting all the PPE we needed initially, even though we use all of that equipment
Right.
at times, depending on the patients we have on service. We don't have huge supply closets like
Probably not,
hospitals
right,
do. We
right.
keep a small closet, and we actually have supplies shipped to individuals' homes.
Oh, that's right. We did. We got some
Yes.
piece of equipment one
Absolutely.
time. Yeah, right.
So we order it, and our staff initially
Right.
have like a trunk bin that gives them a minimal amount of supplies,
Mm-hmm.
and obviously they have access to certain infection control type things, but we don't have a huge
Right,
stock of
right.
anything. So that took us a little bit of time, lots of phone calls to the Department of Health and the state, and working with our BNAs of
Yeah.
Vermont Trade Association. We were able to get that, and then we had to look at every patient we had on service. How could we accommodate their needs? Did it have to be an in-person visit versus a video telehealth visit
Yep.
versus a phone call? And then every referral after that. So we were able to really put that into play fairly quickly too, because we were using telehealth already.
Yeah,
So we had the ability to make that happen.
yeah. And I mean to be skipping around, but you
Yeah.
had telehealth back in 2007.
Correct. We did. We implemented a telemonitoring system back in 2007. It did have video capability, although we didn't use it much for several years. We always wanted to. Some of it wasn't well respected yet and well
Right.
used.
Well, I'm sure your
with the
customers,
physician
your clients
community.
didn't know how to.
Exactly. And we all
Raise my
know
hand.
cellular and broadband in
Right.
Vermont continues to grow. I'm feeling pretty positive that
Right.
we're going to be able to get there sooner than later right now. But we had just changed our system actually about a year and a half, 2 years ago, and upgraded our system,
Right.
which was really great. And we were really looking to fully develop our telehealth. We had
Yeah.
a telemonitoring
And
where
could you tell
individuals.
viewers what that actually? We actually did a
Sure.
show on it. You
did.
reminded me when you
Yeah,
came into the
so-
studio. I think it must have been 2007 because I had
More
Kim
than
and
likely.
somebody else joined her, and it was a great show.
Yeah, so it started off with our telemonitoring program, has tablets like the size of an iPad. It's actually a Samsung tablet. And it has a blood pressure cuff, a scale, as well as a pulse oximeter. And primarily, individuals wake up in the morning, weigh themselves, and then, they may take their meds, may have a little breakfast, et cetera, drink some water, and then
Yep.
plug in and do their blood pressure and their pulse oximeter. Now everything is Bluetooth capable. So,
Nice.
your scale can be in a little different area that maybe you have it set up in your kitchen, and your monitor can be over there tucked
Sort of
away.
pulls it all together, right?
Exactly,
Right.
exactly.
Nice.
So in addition to that, now you can video right on the tablet, And in addition to that, you can send text messages, and also the telehealth nurse manager at the office can video you and then play a short educational video, maybe about your disease process, has a little competency test at the end, maybe a few questions, and then it can actually be a really interactive and really promoting self-management of disease process and doing that immediate feedback. And I know our clients have really adapted to text messaging, the telehealth manager.
Oh, really? Good for them.
Yes, it's pretty amazing.
I was laughing the other day with somebody. I said, I haven't spoken to my daughter actually. That's all we do is text. And I'm like, Stacy, maybe one day we could just pick up the phone and hear each other's voice.
Exactly.
But she's always there, so I know I can get her. So you mentioned the VNA, and you're a member organization.
Yes.
And how does that relationship work? You're separate.
Yes, we are.
But how is there a connect?
So the VNAs of Vermont is a trade association. We have an executive director, Jill Maza-Olson, who has a very holistic view of the healthcare system. So she has great relationships with the Hospital Association, Nursing Home Association, as well as mental health, et cetera, other organizations, other trade associations of organizations. And they're all the 9 CEOs of the VNAs of Vermont, the not-for-profit system. We sit on a board of the VNAs of Vermont. And it's really great because as a system, we're non-compete. We all serve our different geographic areas. So we're able to put together a legislative agenda, of which we have a lobbyist through the VNAs of Vermont. And Jill also is a very strong policy person, so that we can go to our legislators in our different areas with one agenda.
Perfect.
So it's not like all of the VNAs are working towards something different. We all kind of hash it out around the board room table, and we decide on what our agenda is, and we work from that on a regular basis. In addition to that, when there's regulatory changes, instead of each and every one of us reading through all these things, we have groups of individuals within our organizations that work together to develop policies and procedures and share that information. Our quality initiatives. And I think one of the biggest things we did several years ago was we made sure that there were core services that all of our VNAs offered across the state. So whether it was a Rutland Regional Medical Center, a UVM Medical Center, a Central Vermont Medical Center, Springfield Hospital, et cetera, referring to a VNA in different areas of the state, they could rely on the fact that core services were being delivered through that organization.
That makes a lot of sense. And there's always not safety in numbers, but maybe pressure in numbers when you go to the legislature to want to. So you've got all these folks behind you. I knew you were on Rick Sangari's show, WDEV, and I listened to it. You provided for him some of your priorities. Could you give us some of those?
Absolutely. So I think first and foremost, like most organizations, supporting the COVID efforts is really front and center for us. On any given day since December, we've had a good 5 to 10 confirmed positive patients on service. So we're very much active in caring for these individuals. Lots of times we're also doing testing for them at home, and we're discovering they're positive when they're at home, so they haven't even been to the hospital.
Oh, interesting.
So our goal is to really keep them at home in place and manage that environment. A lot of what a pandemic is about is really managing it in the community.
Now, do your folks have to wear special equipment or special garbs when they deal? Because you see in the hospital,
positive, they suit up, they wear a face shield and a
mask.
N95 mask if confirmed positive. If certainly if suspected positive, they have to wear the same thing. Everybody's fitted with N95s. We have kits all put together for them. Et cetera. And then if not, all our staff are still wearing face shields and a surgical mask into every visit. And certainly gloves and all the other things that they use on a regular basis. Absolutely.
Well, because that's also helping the hospitals because, I mean, there's just so many beds in the hospital.
So so our COVID efforts right now, we're working directly with the state, with the Agency of Human Services and Vermont Department of Health with regards to vaccination efforts. And
are you going to be able to give vaccinations?
We are partnering with our EMS partners within our service areas, which is wonderful because certainly there's a lot of individuals that are on our service, but there are a lot of other individuals that can't get out of their home and they need to get vaccines delivered to them. So what better partner than EMS?
Yeah, for sure.
We're all kind of in the same boat out there in the community, and we all work with different agencies throughout our communities.
Another 24/7 effort. Everybody I've talked to, Sue Minter, Mary Moulton, they're all 24/7.
Right.
They've been,
Exactly.
haven't had a breath.
So hopefully we'll be delivering vaccinations to our patients and their family members that are in the eligible age bands.
You must have, is it the Pfizer one that doesn't require the cold?
It's the Moderna.
Oh, the Moderna.
So, yes.
Oh, okay.
So more than likely we'll be delivering the Moderna vaccine.
Yeah, because that doesn't, because the other one requires sub-zero.
Yes.
Interesting.
Yep.
Oh.
So we'll be doing that. Another priority for us is telehealth, obviously. So telehealth is a program that is near and dear to my heart. We were the second VNA to adopt telemonitoring, telehealth in the state of Vermont. And we're really working towards expanding that program. What we've done through COVID, which is something that is in our strategic plan, starting in 2020, which got a little delayed just because of the pandemic.
Well, we understand.
Exactly. So we're working on catching up. And we have integrated a telehealth video visits into all of our care plans for our clients. So we are using it as an active tool to enhance the care that we provide. What better way to really monitor and track how individuals are doing than visually seeing them?
That's great. You know, I have to share, I love my doctor, I just love him. But we had a telehealth meeting, and I found, and while he pays attention to everything I say, it's a face-to-face, you really feel like you're it. I mean, he's really facing, you know, looking at you and what your issues are. And I know he's listening when I'm there, but it's just a different feeling. I like it.
Yes.
I bet your clients do.
It's been a really great tool for us and an opportunity to really stay connected. We know it's actually better care. The more eyes on we can keep on individuals in their home, the better it is.
I think this is going to last through after COVID.
Absolutely.
It's so well received.
Yes, it is. And we're really, we have actually clinical pathways. We had one for COVID, that if this individual has COVID, telehealth visits are going to be included, as well as in-person visits. We want to mitigate risk for all parties involved. But yet we certainly want to keep close eyes, especially on a COVID patient,
for sure.
because we know how things can turn.
I understand it turns
fairly quickly.
It's like one day you're fine and the next night you're not so good.
And it's a tool for them to use too, to get in touch with us, sometimes a lot quicker than calling on the phone, even though calls are routed and there's plenty of us to take calls no matter what.
Yeah, but somebody's watching those screens,
right? Exactly. And in addition to that, we have other care clinical pathways for those disease processes that are at high risk for hospitalization. So then we're trying out a couple other tools. We have stethoscopes actually that our patients can put on their heart, and you know, we can certainly have a doctor or someone else listen in. We've used telehealth to facilitate visits with physicians. So sometimes we have a patient that has some complex needs with regards to wound care or something like that. And we really would love to have the doctor in the room with us. You know, it's hard to arrange a nurse to go to a visit with a patient. So what better way than to potentially do it in the home, do a telehealth visit, have the nurse be able to hear what the doctor's saying, you know, and be able to make sure that care continues.
That's come a long way
since,
since,
about telehealth, and it really having the opportunity to enhance care and really improve the quality of care that we can
as
deliver.
I said, you really feel like you're being listened to, because it's you and the doctor face to face.
Yes, absolutely.
That's cool.
So so lots of things happening there, and we're going to be trialing a couple new things, and once it's trialed and it's working, we'll be announcing that
Now,
formally
if you have a priority for Washington County, and are you able to go present that yourself as opposed to being part of the VNA? Or that doesn't happen very often?
Absolutely. We do that, but as a system, we like to learn from each other. So ultimately, if we start something, another agency may be interested in it, and we share that information, so that the more of us that can be doing it. But certainly, you know, we may apply for grants, we may work with the ACO and potentially rolling out a different program or testing it, and then inevitably we'll all jump on board and things like that.
That's great.
So yeah, there's a lot of great opportunity, and I think our last and most important, I shouldn't even say it's our last, because I think all of these
saving the best for last,
horizontal versus vertical, is recruitment and retention and workforce.
I was actually thinking that on the way over, that I should ask you, because it's hard out there.
Workforce is a significant challenge, especially
Right.
for healthcare. We all
Right.
know there has been a nursing shortage for
Yeah.
a very long time.
And there's a little tempting from one place to another
Correct.
with sign-on bonuses
Yes, yes,
and
there's
robbing
a-
Peter to pay Paul, I
Correct. There's a
suppose.
lot of things happening there. I know something we've been watching, definitely from a legislative perspective, both on the federal level and the state level, has been minimum wage. And Central Vermont Home
interesting.
Health and their board of directors actually made a commitment as of January 1 to raise our minimum wage to $15 an hour.
Excellent.
And we're doing that unfunded. We believe it's the best thing
Excellent,
to do.
right.
We want to promote healthcare as a career, especially in home health.
Right.
It really is a career where you are using skills
Yeah.
that you learn that you may not use in other settings on a regular basis.
Well, and there's so many, there seems to me anyway, so many different levels.
Yes, there
LPN,
is.
I don't even know, but
Right.
there's so many levels you
So
could
the minimum
aspire
starts
to.
at $15 an hour for a personal care attendant who may be working in our long-term care program
Yeah.
with individuals that are really frail and elderly and really wanting to stay in their home, have their, being within their community,
Yeah.
keeping it intact, and all of that. And we're really working to develop programs that can really help our PCAs expand their role.
Yep.
If they want to become an LNA to an
Right.
LPN to an RN, if they just want to become an LNA, we have other options with a community health worker
Yep.
through a program that we're piloting with One Care Vermont through the Accountable Care Organization,
Great.
and really providing a career in
Exactly.
home health. So this is one small step, and trying to really raise our profile and really have individuals think about building a career in home health.
That's great.
And it's really hard work, and it's really rewarding.
Well, and they'll never run out of
And
jobs or
exactly.
positions, right? 'Cause-
Nope, they
yeah.
absolutely won't.
Yeah.
And we all know that the best place for people to heal is in the home.
Yeah, I sometimes think they let you out a little too early
Yeah.
sometimes, but you recover better at home,
Right.
when you're
Right.
surrounded by your things. That's great. So I don't know how you can do this because I've been listening to you. Is there any way you could capsule all the services you provide? Because seriously,
Absolutely.
it's a long list.
So I
This
really
is a
like to
test.
talk about it. So we actually serve individuals, so moms that are having babies, prenatal, with moms and babies, children and families, and we go right through end of life. So certainly within our maternal and child health programs, we've actually seen a significant increase in the care that we provide
Nice.
in that spectrum. And that's really our preventative programs. And when you really think about it and what we're all trying to do with regards to healthcare and reducing healthcare costs and really trying to engage people in their health is really focused on chronic disease management.
Right.
And we've all learned that ultimately where we need to start with that education is really with our children. So it's a really
Right.
great opportunity for us to be able to have these programs. I know myself, I was served on the maternal child health program when I had a high-risk pregnancy, and it truly was my lifeline because I was on bed
That's great.
rest
Oh, I
for
didn't know
13
that.
weeks,
Great.
7
Oh.
of which I spent in Burlington, and I was so happy to get home. And the maternal and child health team really just provided me with
Great.
wraparound support. I was so
Great.
fortunate. But really, a lot of the programs are working with young parents and families, and who doesn't need help when you're going to be bringing in
Do you also
another
work
life
with
into this world?
grandparents who find themselves
Yes.
taking care of their
Yes.
their grandchildren?
Yes,
Yeah.
we do. And then really the next level we go to is our home health services, and that is our largest program,
Right.
and that's those intermittent medically necessary
Right,
skilled
and we thank you
care.
for that.
So the skill of a nurse, a
Yeah.
therapist, an LNA, a social worker, et cetera. And that really falls under that umbrella. The goal of that program is really to build independence, to rehab you, to get you better,
Right.
so that you can be on your own. And, surgeries, knee replacements, hip replacements, pneumonias, change in meds, all sorts of stuff, ambulation, all sorts of
And
things.
24/7, is that not correct?
So
Or
the
they're-
care is intermittent, but we are available
You're right.
24/7. We have on-call. We
A
are
friend of
open
mine,
for
I
service
was on
7
the
days
board
a
and I
week.
didn't know that. A friend of mine told me that 2 in the morning she had a real
Yes.
attack of
Yes.
whatever was bothering her, and she made a phone call and
Right.
she was
Yes.
taken care of. That's
Right.
great.
So in that program, you know, a lot of advanced wound care, et cetera. And then we also have our hospice and palliative care program. And we work really closely with our oncologist in the area and really provide that palliative care where someone may have a life-limiting illness
Right.
and lots of pain and symptom management. They may be going through different trials of treatment, et cetera, and really supporting them and their family in the home. And then we also have our hospice program, which is our end-of-life care.
Right.
And really, you know, doing that full wraparound, offering bereavement services and chaplain services and et cetera, social work and all of that. And that doesn't only go for the patient, but also the family.
Right.
And some of those services continue after your loved one has passed.
Right.
And then the only other program we have, I shouldn't say the only other program,
That's
is our long-term care services.
Right.
And those are really the services related to the non-medically necessary services for those that are frail, elderly, and disabled. You know, grocery shopping, companionship,
Oh.
respite, house cleaning,
Yeah.
laundry, and meal prep. And
Huh, I
really
didn't know that.
having
Great.
somebody in their home to really support them
Yeah.
and being able to age in place. And along those lines, with that program, we have our private care program, as well as we continue to offer flu clinics and foot care clinics.
Oh, I thought you said food. Food.
No,
foot
flu
clinic.
and foot
Yes,
clinics.
foot clinic.
Yes.
Well, if you see something that's, I was just thinking of the 1 in 3 food insufficiency. Do
Mm-hmm.
you, if you notice that, do you reach out to other services?
Yes, we
and,
absolutely do.
yeah.
We have, all our staff are very well aware of the community resources,
Yeah.
and we really try to connect those individuals. We certainly update their primary care physician and the community health
Right.
team member within those practices to say, hey, this
it
is something
just-
that's happening. And actually, through COVID, we've actually been participating in the Everyone Eats program.
Oh, yes, yeah.
So we have
yeah.
this huge freezer, and we
Yeah.
are bringing many, many meals out
That's
to,
great.
you know, families and individuals that do have
'Cause
food
if anything brought it
insecurity.
home, remember that thing at the airport
Yes,
where there was 5-hour waits for the traffic was so
Yes.
backed up. I
Yes.
mean, and all these people needed help.
exactly,
That
exactly.
that was
So we are doing
really
that,
something.
and we also are supporting any staff that may have challenges with food security through that program.
You mentioned talking about the doctors, and I mustn't be a board member that paid attention. You have 2 medical directors that
do.
work with you very closely.
Yes,
and
we do.
I think that's really important because, first of all, they'll know the services you provide. So when you go
Yes.
to them, there's not a lot of learning. And if you ask them questions, they can keep you up to date on new things. And I think that's
Right.
great. And they belong to CV,
Central Vermont Medical Center.
Right.
So our current medical directors are physician staff with Central Vermont Medical Center. And we have a medical director for our home health program, that skilled program,
Yep.
and that also helps us oversee our flu clinics, et cetera. And then we have a hospice and palliative care medical director. And our home health medical director sits on our board committee that oversees our quality assurance and performance improvement program, reviews our policies and procedures, is available to us maybe when we have a complex case that we're concerned about
Oh,
providing
excellent, right.
care in the home, and we
Right.
want to get his input on that. In addition, also facilitates our relationships with the physician community,
Yep.
and also participates in some educational offerings for our staff.
That's great.
So, and then we have our hospice and palliative care physician. That individual is part of our hospice interdisciplinary team. That physician sits on that team and oversees all the hospice plan of cares every 2 weeks.
Great.
So has direct oversight on those plans of care, is informed as to how those patients
Nice.
are doing, is available on a consult basis for any pain and symptom management issues, knows when a new patient comes on
That's great.
service, et cetera. So we're really fortunate to have both of them. They're both highly qualified and
That's
well
excellent.
respected in the physician community, and
Well,
certainly.
it's good to have somebody from your nurses, to have somebody to call
Right.
that they know.
Absolutely.
Yeah, that's
Yes.
great.
So we have to have them available to us on a regular basis.
So one thing, and I want to make sure I have plenty of time for this because it's town meeting day.
Yes.
And one of the things that all the nonprofits have come before the town and asked for funding. And what I found interesting, because I'm on one of those committees that get
Yes.
signatures. Every town is different. Speaking of like the
Yes.
VNA, if we could all just get on the same page, because they're all different.
Yes, they
I mean,
are.
how do you deal with that?
Well, Kim Farnham, our Director of Development
Right.
and Community Relationship, has a spreadsheet, and she keeps track of it all. So
Right.
she has relationships with whomever in the town that is overseeing and managing different individuals that want to be on the ballot or are included in the budget or whatnot.
Right.
And she starts with her team, and they start reaching out and finding out if there are any changes and what we have to do and how we have to do it and whether or not we have to petition, etc.
Yeah.
And then I know our committee as well as myself work with her to determine what funding is appropriate,
Right.
and we have.
Now, you get asked that, because I've actually
we
been
do.
asked that. I, like what is it, the night before town meeting, the informational meeting,
Right.
I'll stand up and say, support CVHHH.
Right.
But I was asked one time, and I had a talk sheet, but it wasn't really as detailed as I think the person wanted. So I got them the information the
Right.
next day. But
Right.
could you talk about how you determine how much you're asking? Because
Yes.
you do a lot of stuff, and a lot
We
of it is
do.
not funded.
Right. We do a lot of work. Primarily, we first start with looking at the visits by town. So we track that information based on where individuals pay their property taxes, and we
Right.
put that in our system. And we monitor that during the year, and then at the end of the year, we look at, or whatever year the town is requesting from us, whatever amount of data, and we look at the number of visits that we provided in those towns.
Right.
And then we also look at the number of patients we serve, and we not only look at patients overall, but based on the different programs that were offered. And then we do trending. I myself look at it just because
Well,
I
you've
want
got
to
the
know.
background, too.
Yeah. And then what we also do is we look at the most current census population. And we also look at any current information related to population
Yeah.
by town. And then it's really a formula based on that, and we roughly look at a percent, a dollar amount per capita,
Yeah.
so that we have everyone within that same range based, and then it's a percentage. So the allotment is really a percent of the amount of visits and the population. And those two percentages are pretty much in line, and that determines
That's great.
the amount that we ask for.
I do know when I stand outside of Berlin's voting booth in
Mm-hmm.
November and ask people to sign, they come in groups because they want to support you.
Right.
So
We're
I've never
very,
once
very
had
lucky.
anybody say no.
Right.
So it's kind of fun to
Yeah.
at least be asking them to sign a petition that they support.
Right. And I did a little research, I think it was last year. I just was going through the archives and really trying to learn about how this all came about with town funding. And what I learned was, obviously all of this started with one nurse, out in the community, and the towns actually used to have nurses go visit individuals in their home. And then once the home health agencies started coming to fruition,
Right.
the towns came to us and said, hey, you guys are in the business of nursing, not us. How about you take this over from us, and we'll fund you on an annual basis
Yep.
to do this work for us, to make sure you can provide to those who need it. So that's really how it started. And in addition to that, I found out that a lot of our work started with children and families
Oh, really?
versus older adults.
Oh, no kidding.
Yes.
Why?
So
What's the difference?
I don't know. It started, I think, maybe moms having their babies at home,
right.
et cetera, needing that
Bite your
support.
tongue.
Right, exactly. Not for me,
No,
but
exactly. We'll pass on that. Thank
but
you.
a lot of, there are still people that do that with midwives, et cetera. And so that's how we started. That's how things started.
That's great.
Yeah, so I'm really glad that we have, at least at Central Vermont Home Health and Hospice, this really amazing maternal and child health program
Yeah,
still.
that's great.
It really
well,
goes
and
back
it's
to
well
our
received
roots.
in the community.
It is.
That's great. What was I going to ask you? Everybody, most of them, I think they say if you asked for 300 this year and you kept it each year at 300, they don't ask you to do any additional work. But if you wanted to go to 500, then you have to go out and get signatures.
Yes.
But this year with COVID, things changed a lot.
Yes, they did. And normally we have a few towns that we have to go out and get signatures.
Yeah.
Our largest, for our larger towns or cities,
Yeah.
obviously that number is significant.
Yeah.
And Montpelier was one of those, and they were really gracious to give us an exemption just for 1 year to not have to
Well,
collect
if we don't have
600
to
plus
ask our
signatures.
candidates to go out and get signatures, I think some of the
Yes.
nonprofits could have
Right.
been, could
So
have
this
stated.
year, so my intent, and it started last year as one of my goals, was to really try to get out and visit either the select boards or,
Oh.
the funding committee that oversaw town funding or
Yeah.
putting individuals, different organizations on the ballot, and get out and visit them, talk about what we're doing for the constituents in their town or
Right.
city, and answer any questions they may have. So ultimately, what we've been doing and what I've been doing is attending different budget meetings that some of the different towns have, or
great.
informational meetings, to be present, to talk about our funding. And last year, I actually attended one of the town meetings, and I wanted this year to schedule to attend more in one day, but it was a really great opportunity to really see how the process works in some of the towns that we
Nice.
deliver service
Right.
in,
Yeah.
and really just listen
Are
to
you
what some of their
just
challenges
Washington
are.
County, or do you have Orange and
Right.
some, or is it just
We have
Washington?
all of Washington County and 3 towns in Orange County,
Ah.
Williamstown, Orange, and Washington.
Oh, okay, all right, because I know everybody, it's really funny,
Yeah.
any of the nonprofits, they have Washington, but they have a little bit
Right.
of Orange
Right.
County, so.
Yes.
that's
Councils on
good.
Aging and Capstone Community
Right,
Actions,
they
they
have-
tend to have a larger scope.
And so I'm presuming Montpelier is the largest.
Actually, Berry City is.
Oh, yes, I'm sorry. Oh,
Yes,
sorry, Berry City.
that's
I
okay.
forgot. I see, because we're sitting here. So you also had a whole lot of changes this year on some of your major fundraising events.
Yes, we have.
Um,
Yes.
And you, speaking of nimble, you guys really turned it around.
Yeah, so our golf tournament, we were really fortunate to be
Yeah.
able to do, and really our community showed up in
Yeah, I was working there. It was an amazing
tremendous
day.
support.
It
I was there
a little
too.
hot.
It was a little warm that day.
A little hot, but-
And it really ended up working out well. We were really nervous about it. I think we did, miss being able to be together more
at lunch,
collectively.
right, yeah.
But ultimately, it worked out really well, and we were able to fill all our slots plus, and it was a
Well,
great
I just
day.
remembered you had bag lunches for
Right,
everybody,
we
so.
had bag
that's
lunches
great.
that we worked
Yeah.
with the restaurant at the country club, and we had everything we needed
Yeah, that
really
was a good
for
day.
it to be successful.
Yeah.
So we were really fortunate. We beat our goal. We were extremely happy.
Yeah.
And then in addition to that, our largest fundraiser, our fashion show that we have in the fall, that was a little bit trickier, but we ended up turning it into a telehealth campaign. And it is amazing, the businesses and
Yeah, right,
donors
right.
and the community that supported us on that.
Yep.
Really, I mean, there are a lot of businesses that are really having a really hard time right now,
Yeah.
and they just continue to
Do you know-
stand up and
isn't that
support
amazing?
us.
I think this, in the middle of COVID, people seem to be more generous than
Mm-hmm.
usual, because even though they're having trouble, they understand that they're not alone this time.
Right.
So
Yes.
it's everybody's really struggling.
Right,
And I noticed that in some of the events, and I thought,
Mm-hmm.
aren't we great? I love I love
yeah,
Vermont.
we
It's
were
a
really
good state.
fortunate.
Yeah.
We met our goal once again for that, which was our budgeted goal for the event, which is our largest fundraiser.
Yeah.
And also we have our Chez Henri Cup, which normally takes place in the valley at Sugarbush. We are still working on something that's a little bit different there. We will have a raffle,
Now,
but it
I
won't
have
be.
never been to the Chez Henri.
It's-
What is that? Is
So
that a-
normally the night before the race, we do
race,
a,
that's why.
a fondue, a ski race.
Yeah.
We do a raffle and fondue party at Chez
Yeah.
Henri, a little wonderful restaurant that when I
Oh,
first
yes.
moved here, my husband took me out on this romantic dinner, and
It's a great
it's such a
restaurant.
great place. And Mr. Henri is there
Oh,
to
nice.
see us, and I call him that just because he's just wonderful.
Super.
And we are, instead of doing that in person, and then the next day we'll have the race, and
Right.
then a gathering after to give out prizes, etc. We are planning on doing a raffle. And in addition to that, they're still looking at doing the ski race. Normally, they race in pairs, but
Yep.
they're going to race as individuals and log
Right,
their times,
right.
etc. So kind of a makeshift.
Yeah.
We may not raise
Well-
as much, but we're still going to promote people getting out and being together in some shape or fashion. And if they want to support us, wonderful.
Well, and I
We
think
want
the-
to be out there
The
supporting
ski
the
areas have
community.
really gotten that down to a science with
Yes,
all of their
they
tourists
have.
and stuff, and you haven't heard much
Yeah.
about them
Yep.
having outbreaks or anything, so they've done it
and
right.
we're actually doing a special little fundraiser right now with
Yes,
Burns
Valentine's.
Chocolate for
Yeah.
Valentine's Day. And they've been so wonderful to partner with us. And we're going to partner with a local florist,
Yep.
Forget Me Not in Barry,
Oh,
as well
nice.
as Emsley Florist,
Yep.
and Botanica Montpelier, and V's out in Waitsfield.
Oh,
And
nice.
ultimately, they're all going to be including truffles with potential flower orders for
nice.
a donation to our organization.
Nice.
Which some may bundle it in a package, others may say,
Individuals,
would you like to
right.
give a donation
Yeah.
and receive this box of truffles? And we're really fortunate to be able to do that
nice.
with other businesses in the community
That's
to
great.
support them. And then we're also selling them to, having our board of directors and our senior leadership team and others be able to purchase chocolates
Yeah.
as well.
Yes, we saw
So-
that the other day. I said to Bruce, "Oh,
Yes.
yes, there you go." So you have, every year you pick individuals or a couple to be your fundraising team leaders or something.
Yes.
And could you tell who these are this year? And,
Yes.
and
So this past year for 2020, for our annual appeal honorary chairs,
Yep.
I actually happened to be one in the spring.
oh, that's wonderful!
time
It's
I've been
about
asked.
time.
And Ed and Trish Reed
Oh,
from the
right,
Valley
right.
were our fall appeal. And for me, it was a great opportunity. We were in the midst of a pandemic, and Kim Farnham, our Director of Development and Community
Right.
Relations, asked me if I would consider chairing this appeal, and I said absolutely.
That's great.
And what I found through this whole pandemic was when this started, our phone was ringing off the hook, and people were calling me directly.
Yeah.
And even though I'm not the one that necessarily goes out and sees the patients and cares for them.
Right.
These are individuals that I know in the community that were scared. They needed support.
Yeah.
They didn't know what to do. They had older parents. They had, family members that had immunocompromised situations, et cetera, as well as assisted living facilities that were like, oh my gosh, we don't have anyone clinical here. How can you support us? What are we going to do? And our medical director assisted us in supporting them
Nice.
and really just making them feel confident that they could get through this and keep everybody safe and healthy. And so I had the opportunity to chair that
That's great.
campaign and really talk about, our role in the community and how we've had to change, but truly our commitment
Yep.
to what we're doing and how we're doing it
Yeah.
not going to change.
That's great, because even the stories that people share a letter to the folks that receive the fundraising request, and it's really amazing. Again, you don't judge. You shouldn't be judging
Right.
people that live in the glass houses,
Right.
because everybody struggles and everybody's got
Right.
something.
Yes.
And I think we're all in this together. And
Yeah.
and this state has so many services.
Right.
You just, Mary Moulton said that the other day. She said, you have just ask.
Right.
Take care of yourself and ask. And it's okay to ask.
Right.
Because Vermont's got just anything you need. They've got the services.
Yes.
They
So
really
I
do.
was really lucky to do that. And then Ed and Trish Reed, so Ed became a new member of our board.
Oh, nice.
Actually, last April of
Yeah.
2020, he was voted onto our board. And he had been in the legislature as
Yep.
Owns a local business,
Right.
et cetera, very active in the community. And we've been really fortunate to have him. And we thought of Ed because I remember my first meeting with a town select board
Right.
for town meeting was the Facein Select Board, the Tri-Town Select Board. And so it was my first meeting, and I went in and I presented to the select board about our town funding request, et cetera. And not long after that, I received a letter from Ed Reed, and this is in 2012. And it was a 2-page letter about how he was so grateful for Central Vermont Home Health and Hospice, how much he appreciated the time and effort we had put into really explaining to the select board
Nice.
our overall organization, what we do, how we do it, and how we're impacting the Tri-Town communities, Facein
Right,
in particular, and really how we came up with the amount that we had asked for town funding, et cetera,
Oh.
and how he wanted to support an organization
Right.
that was healthy financially and really could comment and talk about what has been delivered to
Right,
the
right.
constituents in their town. And so when we invited Ed onto the board, I had always remembered that letter. And I actually found it, and I scanned it and sent it to Ed.
That's a moment.
Yes,
Yeah.
and it talked about how we provided care to his father-in-law, and he had a tremendous relationship with his father-in-law, and just how much support our
Lovely.
hospice team was able to give to his wife and his father-in-law and all of them at end of life,
Nice.
and how he had wished that he had engaged hospice, or they had wished they had engaged a
Right.
hospice sooner. And that just always stuck with me because he took the time
Right.
to write
This
that
is a
two-page
handwritten letter,
a handwritten
a
letter.
dying art, I might
and
say.
That, I'm a paper person.
Yeah,
I
am
save
too.
everything.
Good for you.
And I knew I
Yeah.
had it, and it took me a little bit of time to find it. And it was my town funding file versus I keep a file of
right,
letters I
right.
get and stuff like that
Right.
about our services and all of that. And I had put it in town funding because at the time he was on the Facein Select Board.
That's perfect.
So that's
That's
kind
nice.
of
And
the foundation
handwritten, I love it.
of why we
Make you cry
thought
because
to ask Ed and
isn't
Trish.
there's something very special about getting a handwritten letter or a note to thank you instead of the hand, the
Yes.
typed or emailed. And I'm one of the worst offenders, so shame
Right.
on me. But anyway, I wanted to talk about, we have just about 11 minutes left, but
Okay.
you have an association, I don't know if it's official, but we have so many nursing homes
Mm-hmm.
here in Berlin, and I know my mother had hospice services
Mm-hmm.
from your, do you work with the nursing homes?
Yes, we
So
do.
if there's an issue, like with my mom,
Absolutely. So ultimately, if someone's in a nursing home, they still have access to the hospice benefit.
yeah,
So
okay.
whether it's a Medicare or Medicaid,
So
or
you don't have to be
even
home.
private insurance,
Okay.
absolutely.
Yeah.
Hospice is and home health is provided wherever your home is. So we, go into transitional housing. We're working in the motels. We work with the homeless, et cetera. So it's wherever your home is. And for somebody who's on hospice and their home is in the nursing home, we actually have to have a contract with that nursing home to be able to provide those
Yeah.
services.
Oh, I see, okay.
And then we work with the nursing home. They are obviously part of the care team, a
Right.
significant part of the care team, because that individual lives there. And we basically work with them to enhance the care that's being provided and provide that support
You
to the
know
family.
my story about the red binder? We had a hospice woman from CVHHH, a volunteer,
Yes.
who stayed with my mother for several nights and wrote down everything she said.
Yes.
And on the last night before she passed away, she wrote down something about both my sister and I. And when we got that note, that was it for us. So we're
Right.
not going to talk about it right now,
Yes.
but it was so personal and emotional. That was amazing.
And right now, we haven't, in talking about our hospice volunteers, we haven't been able to use them as much as we'd like, but we are
of
using them
course.
in certain circumstances,
Yeah.
and especially trying to support our skilled nursing facilities with individuals and providing.
Yeah, that's, I was thinking
Hospice
about that's really,
volunteers
they
there
don't
as
allow
well.
visitors.
And the hospice staff and volunteers are able to go in.
Oh, they are, good,
Yes.
because I was thinking about people that are dying by themselves in the hospital, if they wear
Yes.
the same as the nurses, why would you want to have somebody
Right. Yeah.
facing their
So,
last few hours
in
by
nursing
themselves?
homes, we've been very fortunate
good.
to work with them
Oh,
individually,
great.
and any staff entering the nursing homes are being tested on a regular
Yeah,
basis.
oh, that makes me feel better. I was thinking about
yes.
that the other day. You don't want to be alone at certain
Right.
times. That's one of
Exactly.
them.
So our volunteers are playing a critical role for
that's
some
great.
of those individuals.
Yeah, and I know you also offer private care.
Yes, we
And
do.
could you explain that? Because I think
Absolutely.
people would want to take advantage
Yes,
of that.
that is a fee-for-service program.
Yeah.
We have an RN that oversees that program and does the care management and intake with the family with regards to what that individual's
Right.
needs are. And then we have personal care attendants that actually work with that individual. And sometimes it's as simple as, really wanting companionship for that individual. Sometimes they need some support with personal care where we have an LNA go in. And other times it may be just, coming in and doing their laundry, helping them keep their home, really just being that support factor. I know of recent, we had a private care individual who was living at an assisted living facility and actually had moved back home with his son and wife in Montpelier, and he was actually going to be 100 years old.
Oh, God bless
and they had private care, and with COVID, they had they had stopped the services initially between March and early summer, and then they started them up again. And we were really able to support the family, him and his wife, to be able to get out and really be with his dad and make sure everything was okay. And they felt safe having us in. Right. And his dad actually turned 100, and they just wanted to have a few people over, just some family members over, and we were able to provide testing to all the family members.
Nice.
To be able to allow them to celebrate their dad.
He would definitely be in
their
that.
Dad and family members' 100th birthday.
Right.
And then Dad came down with some symptoms that seemed to be COVID related. They got really scared. We were able to go in and test them and get the results back fairly quickly for them, and really just give them that sense of
and it wasn't
support, and it wasn't, and that everybody could remain safe, and that also they had an opportunity to be able to get out some and do what they needed to do, and know that their dad was in good hands.
It just reminded me, do you deal with caregivers? I mean, if you into a house and you see that the wife or the husband is just a little afraid, just at their wits' end a little bit, are they able to chat with your folks and
Yes,
get
they
some...
are. And certainly when we see that, we try to figure out what is the best support for those individuals to get,
good.
Whether it's caregiver support, which is offered, there's been programming offered through our local councils on aging, et cetera, for that. I think right now with COVID, everything's a bit on hold, although a lot of this stuff is still available virtually, or has become available virtually, as everybody gets used to, being in this world.
Because we were talking about that the other day with somebody, and you forget about the caregiver.
Exactly.
Who is
yes.
at
And
home with these people.
That's why certainly we have those volunteers for our hospice program, and we've even thought about, if there are other situations where a volunteer may be needed to support a family, we're going to try to get them in there, especially right now.
That's great.
And knowing that, they're going in under infection control and all the rules and regulations that are being managed from a healthcare perspective.
I said to my husband the other day, because I said, you can get a cold these days.
Right, exactly.
The minute you have anything, everybody goes berserk.
Yes.
And I said, you can get the flu. I don't even have seen any statistics about the flu. Is that even around anymore?
It's actually very, very low levels of flu. And
isn't that interesting? Well, because we're hiding from each other.
Exactly. So it hasn't been able to do its normal thing
I
of growing and all of that.
Because I got my flu shot. I always get my flu shot, but you don't hear about the opioid crisis.
No.
It's like it's all gone away, because all we hear about, but I know opioids hasn't gone away.
Exactly. There's a lot going on.
Do you deal with that
arena. Yes, we do.
do
There are cases where we have individuals that are struggling. In those situations, as well as sometimes it's an older adult with someone caring for them that has some dependence on that, and there are
that's
individuals
sometimes the
coming in and
grandmother
out of the
taking
home.
care of the grandkids.
Right, exactly. So there are situations that we confront that are difficult sometimes to manage, and we are mandated reporters, so we have to make sure we're on top of that.
Bless your staff for dealing with all that, because the young woman I went out with, we visited 3 homes that day we went out, and everyone was completely different. That's and she just had a little mindset change and just switch gears and, right on target, and being able to deal with and it was 2 women and a gentleman. And I was very impressed. It was great.
Yeah, there's really a lot to say about, the staff that are delivering the care. They're
must be special
pretty
folks.
amazing.
Because I think there's a lot of places I'm sure they go into that are challenging,
Yes.
to say the least.
Yeah, and I think the one thing I learned in taking care of my mom and working with my brother and trying to keep my mom home, and she was out of state, was inevitably we had a situation where we were engaging private care because we needed some supplemental care, and the person came in, I think it was a nurse, and just said, oh, well, you need this and you need that and you need to do this and you need to do that and all that. And I was just like,
whoa,
wait a minute, you know, like
Right.
this is our world.
Yeah.
And I think sometimes that's hard for any of us because we all want to go in and
change.
fix everybody,
Exactly,
right? We want their situation to improve.
Right.
We want them to get better. And sometimes it's really hard just to accept that this is the norm for them.
Right.
And these
That's
are our
interesting.
goals and the goals that they want to achieve, and really focus on, you know, what are your goals? And
Yeah.
their goal may not necessarily be our goal.
Yeah.
And we learn about, you know, okay, well, how are we going to get them to be medically healthy?
Right.
We have to address this. And
Yeah.
sometimes that's what we learn. So that's how we end up having to work with all our community providers that may be involved in caring for these individuals.
I never thought of that from that aspect,
Yes.
for sure.
So,
Huh.
yeah, it's definitely, the staff are pretty amazing.
Sandy, I have about 2 minutes, and I would
Okay.
love you to talk to the audience and run over talk about anything that we haven't talked about. And I
Geez.
don't know, we've covered everything, but
We have talked about a
yeah.
lot. I think really, as Central Vermont Home Health and Hospice, the community is like our bedrock of our work. There's no question we couldn't do what we do without the support of our community.
Right.
That has shined through in a pandemic where everybody is challenged, and you know, what I say is challenge creates opportunity. We've had great opportunity to partner with other providers that we may work with, but not as closely as we could.
Yeah.
We've found really great ways to work with our local EMS partners, which has been a wonderful and amazing opportunity to really try to support some of these individuals at
interesting.
home that have some really complex needs,
Yeah.
and really feel like we're doing this together. And certainly our goal is to really work with all of the providers in our community, as well as the Vermont Department of Health and Agency of Human Services, to really control the virus in the community. That's where we need to do it.
You give us your website, please, because you have
Yes.
if you want to know about CVHHH, they have a fabulous website, which you worked on. You were working on the website when I joined the board, and it was
about
yeah.
4 or 5
It
years
was a
ago,
great
we
process.
revamped the whole
Yeah,
thing.
it was
And
great.
we're looking at doing it again, just
Oh.
based on things evolve.
Yeah.
It's been about 5 years and things have evolved.
Exactly.
So our website is www.cvhhh.org.
Excellent. Cindy, thank you very much for joining
Thank
us.
you, Pat.
Really nice to see you. Wish I could shake your
Great,
hand.
I know.
But we can elbow bump. So thank you all, and thank you for tuning in. We'll see you next week, and in the meantime, keep listening beyond the soundbite.